Now we will move on to the second session. This session is to discuss on what are treatment options for metastatic disease, biomarkers for precision medicine, new clinical trials. Without further ado, let's welcome the moderators, speakers, and panelists. We kindly ask Professor Seoga Im, the Director of International Affairs Committee in Korean Cancer Association, and Dr. Irina Jang Ji-gyan, Memorial Sloan Kettering in USA, and Dr. Narigaju Boku, Institute of Medical Science of University of Tokyo Hospital in Japan, to moderate the session. Please.
Thank you very much. Good morning to Asian patients and guardians, and good evening for patients who are joining in America and EU. Welcome to session 2. I'm Seoga Im. I'm a chair for the International Cooperation for the Korean Cancer Association. I'm also a medical oncologist working for Seoul National University Hospital. In this session, we will deal about what are the treatment options for metastatic disease and biomarker for precision medicine and new clinical trial. Fortunately, we have a well-known global medical oncologist and patient panelist working for gastric cancer, and we are very appreciative to their participation for this session. I would like to introduce two moderators for this session, Professor Elena Jang Ji-gyan from MSKCC, who is a well-known medical oncologist for gastric cancer, and also very interesting to educate the patient in the world. And Professor Narigaju Boku from University of Tokyo, who is also a global medical oncologist leading many global clinical trials. So we have two speakers, and each moderator will introduce each speaker. And then we have a panel discussion with panelists and patient panelists. So Professor Elena Jang Ji-gyan, would you moderate case 1?
Yes, absolutely. So we'll start with the first case. I believe it's the HER2-positive case, right?
Right.
Yeah, okay, great. It's a pleasure to discuss this case. Dr. Kim is a expert in treatment of patients with gastric and GI malignancies. Extensively trained with medical background and from Seoul National University, and both medical degree and PhD and MS as well. Completed his internship at Seoul National University Hospital, then stayed on to train there as a resident, and then went on to have fellowship at Seoul National University Hospital as well. He's currently assistant professor and was recently promoted to associate professor at the university based on his work and focus to help these patients. It's a pleasure to be able to hear the discussion and the presentation of my favorite topic, which is HER2-positive gastric cancer. Please go ahead.
Professor Jang Ji-gyan, would you maybe moderate this session for the discussion regarding HER2-positive gastric cancer? And would you give your opinion first regarding the status in US and lead the session discussion for this?
Sure. I think this is a very typical case, and thank you for bringing this to our attention. I think the first notable aspect of this case is how young this patient is. And it's absolutely true. The age of onset for esophageal and GE junction cancers, and even some proximal gastric tumors, is declining. There is increase in incidence of these patients, particularly among young men, and we don't exactly have all the facts, but there's a lot of research, and my group and in our lab, we're examining the component of patients' innate sort of exposure and risk and the host factors that allowed the cancer to develop at such a young age. And so it's a combination of tumor factors and also the patient's inability to screen and protect themselves from their immune system failing. The other interesting aspect about this case is the level of HER2, right? So we know that patients with immunohistochemistry high IHC3+ tumors tend to be derive the greatest benefit. And later on in our discussion, we'll talk about the value of NGS, next generation sequencing. But we know that for HER2 in particular, we know that co-occurring alterations may help us predict how durable will be the response beyond HER2. And we'll get to that later on tonight. What I found interesting is how long this patient stayed on cisplatin. So 20 cycles, that's quite for a long time. And in our experience, many patients do develop significant toxicity. So for our patients out there, I see that we have 250 participants. This is amazing. Tell your doctors, I'm not feeling well, I'm having neuropathy, or I'm having nausea. Very few of my patients really remain on high dose treatment, and most of our patients require dose reduction. And once we have a maximum response, we can de-escalate and drop the platinum. In the United States, we typically use oxaliplatin, that's the preferred backbone, and so forth. We have been able to make some strides in first-line space by targeting dual anti-PD-1 and anti-HER2 therapy. For HER2-negative disease, we know that immunotherapy has changed practice. And now for HER2-positive disease, at least in the United States, we have preliminary data based on interim analysis of a large phase 3 study suggesting there may be synergistic, additive, meaning 1 + 1 = potentially 3, benefit from immune checkpoint inhibitors, immunotherapy plus trastuzumab. And so, the landscape changes. It's very important to continue to test for biomarker, ask your doctor, were all the biomarkers tested? And HER2 is the first one that we've learned about over a decade ago, and it remains one of the most important ones. And so this is a very important case. The other aspect of this case that I really, really like is the point that this is, even in South Korea, HER2 is a rare disease because it's only about, depending on which subset of gastric and esophageal cancer you look, only about 10 to 20% of tumors overexpress HER2. So it's by definition an orphan disease. So it's very important for you to find a doctor who's an expert, and it's very important for you to find the doctor that you trust and then participate in clinical trials. I tell this to my patients all the time. Patients who came to see me in 2013 or 2016 and went on one of my trials were able to get the treatments that are now available to the rest of the world, right? So they were ahead of the curve because they trusted their clinician and their research team, and trust and therapeutic relationship is critical. So I really enjoyed hearing about this case in second-line setting. Clearly, confirmation of HER2 is very important. We have Professor Shatara on, he could tell you more about development of trastuzumab deruxtecan. But really enjoyed hearing this case. Thank you for bringing it to the forum.
Thank you very much. Professor Kim, would you give your opinion regarding the cisplatin, because we stopped the cisplatin after a while. So would you give your cisplatin question from...
Thank you for the good comment and the good questions. Chemotoxicity is the main problem for doctor or the patient. Many patients experience the neurotoxicity after treatment progression, especially the platinum. So in Korea, after 6 cycles, we discontinue platinum because of the concerning of neurotoxicity and other toxicity. So in that patient, I continue capecitabine plus trastuzumab after 6 cycles. Also, we have to be cautious with capecitabine toxicity, especially hand-foot syndrome. Fortunately, patient didn't have any hand-foot syndrome, so we can continue Xeloda plus trastuzumab till 20 cycles.
Thank you very much for your comment. And at this time, we have our panelists and our patient panelists here. So I would like to introduce panelist Professor Samuel Klempner from Massachusetts General Hospital, USA, and Professor Lin Shen from Peking University Cancer Hospital in China. And we have 3 patient panelists, Amy Jacobson from USA, and Keiyu Zhang from China, and Hiromi Todoroki from Japan. So I very much appreciate for your contribution for this panel. So we have maybe 2 questions from patient panelists. Mrs. Hiromi Todoroki, would you start from your story and ask the question?
Thank you. At first, I'm Hiromi Todoroki from Japan. I am chairperson of nonprofit organization for stomach cancer patients. I lost my husband due to stomach cancer. Even so, he underwent screening examination every year. His cancer was detected at advanced stage. So I am working with the hope that everyone will be able to make choices without regret. And I think it's important for patients to know about their biomarker. And actually, my husband participated in a phase 1 clinical trial. I think that clinical trial is an important option for patients in advanced stage. However, in Japan, it's not easy for patients to access clinical trial information. Especially, it's not common to access clinical trial information before starting treatment. How did these patients access clinical trial information? Please show me.
That is very great question. So my patient asked me for appropriate clinical trial and biomarker. To obtain the biomarker, we checked kinds of immunohistochemistry in Korea, for example, Her2 or PD-L1 or MSI, and some patients conducted NGS for their own mutation information. So in Korea, fortunately, Korean government build a clinical trial search site in Korea. So if patient want to obtain information, they can easily search clinical trial information in government website. I think it's different from countries. So generally, many experts recommended American website clinicaltrial.gov. So we can obtain the information from the website. So I know it is not easy to access clinical trials.gov. So I think it is a very easy way you ask your doctor for clinical trial.
Thank you for the comment. I'm curious about the situation in US. Professor Klempner, would you give your opinion regarding the access for the clinical trial for patients?
Yeah, sure. Thank you for having me. And I agree with Dr. Kim. It's not an easy answer, and the clinicaltrials.gov website in the US is not easy to navigate, although it does contain a lot of information. I really think that this falls mostly onto the doctors to educate our patients, and to groups like the one that you run, Hiromi, to get the word out there to other patients to ask their doctors, because really that's where the most up-to-date information is going to come from, is the people who are taking care of the patients, particularly, as Dr. Janjigian mentioned, the larger academic centers where most of the trials are run. It's probably important for every stomach cancer patient to at least be seen at a large academic center at some point along their journey. because that is the place where most of the research is being conducted. And that is where most of the education about trials will happen. But we encourage all of our patients to ask those exact questions. And there are some good educational materials from the NCCN in the US that gives a list of questions that every patient should ask their doctor. And it includes, are there clinical trials available for me at this stage of my disease? So I think a lot of it comes to just down to asking your treatment team.
Thank you for your comment. And Professor Shitara, would you give the Japanese situation to Mrs. Todoroki?
Yeah, thank you for asking. And actually, Ms. Todoroki's husband enrolled into clinical trial in my institution. I have a chance to take care of him, and I introduced him and Ms. Todoroki about the clinical trial as a treatment option. So I agree with Dr. Krempner about the communication and the previous Korean speakers about the relationship with your doctors and the patients should be very important. So always to ask about the treatment option and the clinical trial is good for patient. And I also agree with the previous comment that there is no good way for patient to know in internet or some resource. So more patient-friendly resource must be needed in Japan. So same situation.
Thank you very much. And we will discuss about Chinese situation after we hear from the Mr. K.U. Zhang. Would you give your experience and sharing your experience and question to Professor Lin Chuan? And we will also discuss about Chinese situation.
主持人你好，主持人你好，能听见我说话？当时我是应该是在我的分期吧比较晚，发现的比较晚。当时那个这家福团队的整个团队建议我就是这个参加。
Professor Lin Chuan, you hear the question from Mr. Zhang?
然后这个建议我吧做这个降低这个分期，当时我也充分的相信这个团队的建议。
And also before that, we were talking about like degrading, and I was fully, I believe, for those consultation outcome from my team. And also, I was hoping that, with sharing more of this clinical trial resources to the patient, could really benefit for those patients who really have no much hope.
Sorry for that. The internet connection from Professor Lin Chuan was disconnected. So I think it's better to go forward for the next session, and then we will discuss again, if Mr. Zhang allow us to do that. And for the next cases, I would like to the moderator, Professor Narigatsu Boku, who is a very well-known global clinical trial leader in Japan. Would you moderate the second case, and then we will hear about the second case?
Can you hear?
Yes, I can hear now. Yes, thank you.
Okay, so I would like to introduce Professor Shitara.